Well, the Department of Labour has made 1.35 billion rand available from its compensation fund, this to finance vaccines for uninsured workers who have no medical aid cover. Well, the department says the funding will be used for the phase 2 vaccination of an estimated 3 million workers. Let's unpack this with the Labour Department's Compensation Fund Commissioner, Mr. Vuyo Mafata. Mr. Mafata, thank you for your time and good morning to you. Perhaps before we get into some of the nitty-gritties around this initiative, let's define the beneficiaries of this particular initiative, right? So when we talk about uninsured workers, are they permanent? Are they, temporary workers? Are they earning a certain amount, per month in terms of their salary? How would you sort of describe the beneficiary for this initiative?
Thanks, Tumelo, and good morning to the listeners. So the funding is made available through the COVID legislation, which defines who an employee is. And in terms of the COVID legislation, any person who has entered into a contract of employment is defined as an employee who is entitled to benefit from such. And maybe just one thing, so the funding is being made available by the Compensation Fund in partnership with the REN Mutual Assurance as well as the Federated Employers Mutual Assurance.
Right, and I was about to ask you who the funders are, the partners are, and because you've clarified that, let's then talk about where this fund will then fill in the gaps for government, because there have been concerns that, not enough, vaccines are administered, the pace at which they're administered. So where are you hoping this fund will fill in some of those gaps and challenges by government, do you think?
Well, we're hoping that this would contribute towards the funding of the whole vaccination program. So this is just one part of contributions which we hope that many others would also add to the pot.
Right. With that being said, where does the success of the procurement of vaccines lie, do you think? What would need to happen to see a very successful, fast-paced procurement of vaccines in this country?
Well, I'm not an expert in that area of logistics and so on, but I think the Department of Health has it under control.
Right, and I'm asking because I think, according to your press release, which has been forwarded to us, it seems you're of the view that private companies need to come to the fore. More partners need to lay their hand. I think even also Minister Thulas Nxesi had mentioned this during his address, that the department is appealing to the private sector. Is that your stance?
Yes, I think we can do a lot towards assisting with government with this program. I think it's important because we need to make sure that we fight the scourge of this disease and make sure that no worker is left unsafe in the workplace.
All right. Mr. Mafata, I want to ask you about perhaps this past year alone in terms of the number of claims that you have received and the number of liabilities that you have accepted. Where do they stand in terms of that number?
Well, we until end of March, we had received about 20,000 claims, and of the 20,000 claims that we had received, about 12,000 of these we had accepted liability and had compensated the injured workers as well as had paid for the medical treatment that went with the disease. Right, and if we believe that the numbers could have been much higher, but I think if we know that the department's occupational health and safety inspectors were hard at work during the lockdown to make sure that we assist employers to keep the workplaces safe. Right, and
I think also with that being said, there are fatalities that unfortunately, you had recorded there in terms of the members and as well as the workers being affected. But also in relation to that, particularly the fatalities, what support was then offered to the workers from, the department's perspective?
So in a case of a fatality, so the one form of support that is offered in terms of the COVID legislation would then be a funeral expenses. We pay for the funeral expenses. There is then also pensions that we pay out to the surviving dependents of the worker who succumbed to the disease.
All right. And in terms of the funding, I understand that it's approximately 1.35 billion rands, if my number is correct. Have you already, decommissioned, distributed those funds for them to be utilized by government? Are you still waiting for certain timelines and, dates before we can see that money actually being used as part of this vaccination drive?
Well, so we are still working out the modalities of how this money would then be released, and I think in the next couple of days we should be clear as to how we're going to then contribute the money.
Sure case. Mr. Vuyo-Mafata, thank you for your time and thank you for talking to us and talking about more of this initiative and how it will impact your workers. Labour Department's Compensation Fund Commissioner Vuyo-Mafata.